Welcome back to day 2 of Living Well and Beyond Cancer, the Irish Cancer Society Virtual Conference 2020. My name is Dr. Eddie Murphy and I'm going to be your MC for the second day. Really powerful today. We've got lots of incredible speakers, some brilliant workshops. Remember, I'm on the main stage twice. And then you can go into the sessions where you have our workshops, and there's going to be incredible workshops that are videotaped and they're available for you at any time. You can go into our networking place. You can go into our expo place. So lots of activity going on here today. And we have 3 brilliant speakers as well. We have Louise Mullen from the National Cancer Survivor Programme talking about survivorship and self-care. We have Dr. Brian Bird, an oncologist from Cork. And we have Brian Kennedy. Brian Kennedy is going to sing for us this afternoon, and he's going to share some of his insights and part of his journey in cancer as well. So an incredible day we have in front of us today. Let's stay with each other. Let's get your drinks, use the breaks well, come back and join us and link in regularly with us. But first of all, we have Rhona Nally today. Rhona is diagnosed with a metastatic breast cancer in 2003. She's a peer volunteer with the Irish Cancer Society since 2008 and was awarded the Charles Cully Memorial Medal for her work as a volunteer. Incredible lady. Let's welcome Rhona, and thank you very much for joining us today, Rhona. There's Rhona.
Good morning, Eddie. How are you?
Hi, good morning, Rhona. Thanks so much for joining us. And I think because you've got this lived experience, it's an opportunity for us and to maybe just have a conversation. And I know we just met in a very virtual way, but to give us some sense of what's happened to you from 2003. Can you maybe take us back and bring us forward as well?
Okay, well, in 2003, I was in my 40s. I was a primary school teacher. I was working 3 children and well and healthy. And suddenly, by chance, I found a small lump in my breast. So, of course, things proceeded there. And to cut a long story short, I was diagnosed with early stage breast cancer.
Okay, and that shifted as well then for you, didn't it? Because not after you had that, then you had a metastatic diagnosis as well.
Yeah, when I was diagnosed with the primary breast cancer, I went through the year of treatment, surgery, radiotherapy, chemotherapy, and I finished that towards the end of August in 2004. And just within a few weeks, I developed back pain. And after having scans and tests and everything, I was diagnosed with metastatic breast cancer with multiple mets in my spine. So that was pretty devastating at the time.
Okay, and I like when you use the word "at the time" because in some place you have accommodated or you've shifted in your view of that, I suspect.
Well, of course, when you get the diagnosis, it's such a different space from your primary diagnosis because, I was told my prognosis was very poor. So with primary breast cancer, you have the hope of a cure, and there's an end in sight. But metastatic cancer, it's incurable, so your treatment is ongoing, and there wasn't an end in sight, at least not one you wanted to think about.
Sure. The challenge then is this living well with cancer, and maybe you could talk to us a little bit about that and your work with the Irish Cancer Society and your work as a volunteer. It sounds very important to you.
Yeah, well, I suppose the important thing to remember is that people with metastatic cancer are not dying with their cancer. They're living every day. And the hope is that you continue to live well and you live your life in the best way you can. And you hope that there'll be a treatment that will enable you to do that and, will work for a period of time. And if that stops working, which tends to be what happens, that there'll be another treatment and you could continue like that. And the reality is now, when I was diagnosed, say, with metastatic 16 years ago, then, things were pretty not as hopeful as they are now. there were less treatments. There's been huge advances. And, as I said, my prognosis was poor. So I very much wanted to be around for my children. So I looked to find supports that would enable me to find information on how best I could look after myself in terms of treatment, managing side effects, a diet, exercise, all those things that would hopefully help. But I found that there were very much a lack of specific supports for those with metastatic disease. There were lots of supports for those with primary, but it's a very different experience, and the feelings are very different. The day-to-day reality is very different. So I did access some supports, but they were more geared to primary, and it was difficult to voice questions or voice concerns because you were afraid of upsetting the rest of the people there who didn't really want to hear about metastatic disease. And I did find supports in cancer in the Cancer Society, in cancer support centres like ARC. In the hospital, they had a psychology unit, so I did have some cognitive behaviour therapy, but I had to seek that out, and it was very difficult. And when you're not well, it's hard to find those supports. So I suppose that's why I had very strong feelings that I wanted to become involved and to maybe help setting up those supports. So I suppose that's why I got involved with the Cancer Society in 2008. And initially we looked at the services of what was needed. And then we set up the Living Life group, and we trained to be peer supporters. And from there we went on to develop the Living Life program, which is an 8-session program for those with metastatic disease.
And just give me the name of that program again.
It's called the Living Life program.
Tell us a little bit about that program, because I think a lot of people that are maybe tuning in today would not be familiar with it. If you could give us a sense of that, it would be helpful.
All right. Well, initially it was run as a pilot scheme in the Cancer Society, and then it was outsourced to the affiliated cancer centres. So it's run in different areas throughout the country, affiliated centres. Now, obviously, at the moment, it's not happening because of COVID, but it's an 8-session program where the patients have access to, an oncologist, a psychologist, a dietitian. Talk about fatigue, about self-care, about the emotional impact.
And did fatigue play a role in your sort of part of, for you, Rhona? Did fatigue play a role for you? Because I know in our house, my wife, who experienced cancer, has this chronic fatigue, so it's often misunderstood. I'm not sure.
Yeah, I suppose anyone who's undergoing treatment will have fatigue to some degree, and depending on the stage, or what particular treatment you're on, it can be worse or better, whatever. So I suppose what worked for me was just listening to my body and going with that feeling. So if I needed to rest, then you had to rest, and if you were feeling better, then you could do some more. And you have to somebody with metastatic illness doesn't have the same level of stamina or energy as somebody a well person. So they have to work within that. So maybe set the priorities, or what's very helpful is getting you're surrounded by love and support of your family and friends, and they're only too willing to help. So taking advantage of that help, and maybe getting them to do the things that aren't as important, so that you can prioritize spending time with your loved ones and doing the things that are important to you.
So some really great guidance there for somebody with the live experience, Rhona. Thank you so much for sharing about that, sharing about how to listen to your body, to set your goals and pace yourself really well. Some incredible wise words there, and we thank you so much for your wisdom.
Can I just mention also, Eddie, now that COVID...
Please do, yeah. As a volunteer, the impact of COVID on your role?
Yeah, obviously the Living Life programme isn't running, but there is still, I work as a peer supporter, so the helpline, the nurse support helpline, is still operating every day, and they refer patients to me and to other people who do support calls. So we are interacting with people on the phone. And, you know, for someone who has had a metastatic diagnosis and might be feeling really isolated and afraid and anxious, it's just so important that they can talk to somebody who's gone through the same feelings and absolutely understands. And they can express those fears and feelings. Sometimes you protect your family or you don't want to talk about those things. So, you know, that's ongoing. And I'm getting referrals from the helpline and from the daffodil centres. And so that's really important support for people with metastatic cancer and primary, obviously, as well.
So I want to thank you and all the peer supporters, the amazing work that you do, the support that you offer people, and the capacity to give to others. I really appreciate that. Thank you so much.
Thank you, Eddie.
Thanks very much. That was very enlightening, and I hope you got something from that, because I did. So folks, yesterday I asked you to complete a poll, and the poll yesterday was on the whole area of stress, and what we identified was that 20%, well 90% of people experienced more stress associated with this COVID period, and 20% of people, there's over 100 people responded to the poll, identified that it was extremely high, the levels of stress for them. Now, today I have another little poll for you, and I'd like you to get involved. Today, this is a conference, and if you're in the hotel, it was all about connection, remember, you could network, you can go into the sessions and the workshops. I'm going to tell you all about them later on. But at this poll now I want to do is about self-care. And we all know the importance of self-care. But what I'm interested in knowing is, how much are you practicing self-care? How much are you practicing it? So a poll is going to come up. I'm going to ask you to just click a number and click an area, whether it's very often, a little bit, or not at all. I'm very interested to know how much energy you're putting into that self-care for yourself. Okay, and we'll reveal the poll results later on, so we will. We've got two more amazing speakers this morning, and we have Louise Mullen, who's from the National Cancer Control Strategy, and Louise is going to give us what I call like a helicopter view, an overview of where she's head of the Survivorship program, and she's going to give us an overview of where that is at, and then we're going to go almost into the office. And we're going to talk about how we can make the best use of our outpatient contacts with our oncologists, our medical doctors, our care team, so that we're going to have that conversation as well. So now for the helicopter view, I'm going to invite Louise, who's going to give us an incredible talk on the whole area of the National Cancer Control Program.
Hello everyone. I'm really delighted to be here this morning. My name is Louise Mullen, and I work in the National Cancer Control Program. The National Cancer Control Program is part of the HSE, and it was established 13 years ago to implement the national cancer strategies. The NCCP provides leadership across the continuum of cancer care. So this includes prevention, early detection, treatment, and of course, living with and beyond cancer. My role is to work across sectors on a national basis to develop cancer survivorship services and supports for cancer patients and their families. So today I'm going to talk first about the National Cancer Strategy and how the strategy was built and framed and how it is different from previous strategies. And then I'm going to talk a little about the needs assessment that was conducted last year and how the research and the things that we found within the needs assessment is providing a blueprint for services in the future. And then I'm going to talk about self-care and how the goal of encouraging self-care is actually better well-being for cancer patients and their families. But importantly, that self-care is ultimately an act that an individual performs, but is the joint responsibility of things like national policies and strategies, healthcare services and providers, and you and me as individuals. So previous cancer strategies were focused to a greater degree on structural reform and cancer services such as centralization, rapid access clinics for diagnosis, and treatment expansion. These elements have improved our cancer outcomes and remain extremely relevant today. But what is different about our current strategy is the central role of patient experience and the patient voice in shaping the contents. Hence, we have a greater concentration and emphasis on quality of life, cancer survivorship, psychosocial needs and outcomes, patient engagement and prevention. And this was due in no small part to the role that the Cancer Patient Forum played in the creation of the strategy. The forum sat in deliberation in parallel to the steering group and had constant liaison and contact with the steering group chair at all points in the process. Other voices also contributed to this emphasis, and that included the public consultation, healthcare professionals advocating for patients, and international movements around patient engagement and survivorship care. Charity and voluntary organizations also played a role, and they provide support to cancer patients, and we're hearing the necessity to place a different emphasis in our national strategies. So the strategy has a lot to say about survivorship and living with and beyond cancer. The section on self-care for cancer survivorship talks about patient empowerment. So a number of years ago, pre this current strategy, the NCCP conducted a pilot program on a patient treatment summary and care plan. There was a lot of learning in this pilot, and one of the things we learned is that we asked some of the patients what they thought about this new initiative. And they said, well, really the hospital and the doctors and the nurses look after us. The nurses are great and they take care of me, and I don't really need this extra information that you are giving me. Now, in one way, this is lovely, and the doctors and the Irish cancer nurses are lovely, and it's nice to be just taken care of sometimes. But the flip side is we haven't really supported and prepared patients for the survivorship period and for survivorship care, and neither have we equipped them to enhance their own well-being and quality of life. So the National Cancer Survivorship Needs Assessment was completed last year and consists of a scoping review of cancer patient needs and also a piece of research, a mixed method study of cancer healthcare professionals who helped to identify us what needed to be built and developed in survivorship services. This document is a blueprint for how we are going to fill the gaps. So it recommends education and skills around preparing patients for living with and beyond cancer. skills learning in terms of supported self-management, and making survivorship programs available to a wide range of people and needs. It signals the need for better information, targeted information, linking resources from our services and communities to help cancer survivors and their families to adjust. We are not there yet, but we are building those supports, and we have a clearer vision of where we are going. And finally, and also, how can we encourage and support self-care? First of all, self-care is a deliberate decision on an individual's part to allow themselves to nurture their physical and/or mental health. It can be taught and encouraged. We all do this in our own unique way, and it's really important to pause and identify what nurtures you. The evidence base suggests that physical movement, getting out into nature, social connectedness, eating and sleeping well are all ways we can self-care. I quite like the idea of forest bathing myself, getting out into nature and just soaking up that atmosphere. But what I recommend is pausing in your own life to identify and gifting yourself that time to identify what it is for you that you need to self-care. And then also seek out, if you need them, the supports to be able to let you make that part of your everyday life and your habitual practice in your life. So there are resources for this. Some of these are healthcare professionals, oncology teams, community cancer support centers, which are in every local community in Ireland. Survivorship programs such as Cancer Thriving and Surviving, and physical activity programs. There are also national organizations like the Irish Cancer Society and others who will help as a resource. So this is what I'd like to leave you with, this sum up slide. And it really is that actions are needed at all levels. As individuals, we have to prioritize our own decisions around self-care and well-being. But health services also need to build services and support and encourage the empowered patient. And the community needs to create opportunities for us to engage in connected, healthful activities. So preparation is needed to support and empower patients, to encourage self-care. We also need to link up what is already there. There are resources within our community, and we need to use them and then build where there are gaps. We need to support prevention, and the recently published European Code Against Cancer is an evidence-based template to help us do that. And if you are finding it tough going, reach out for support. During this pandemic, the cancer community came together and collaborated to provide the Together for Cancer Concern helpline. This used an existing infrastructure of the Irish Cancer Society support line and a network of local community cancer support centres and their resources, and extended access to psychological services through a panel of clinical psychologists in Cancer Care West. It is still available with a full range to help with a full range of psychological distress. And finally, please continue to be involved and remain connected. Your voices are heard, and they really contribute to the evolution in cancer services nationally. Thank you.
Okay, thank you very much, Louise. That was very enlightening. I always feel that, we need to have a helicopter view at some level to navigate. We need a compass and a map, and the strategies helps us navigate that. Now we're going to go a little bit more local, as the person says. We're going to be joined by Dr. Brian Bird, who's a consultant oncologist in the Bon Secours Hospital in Cork. And we're going to talk about what happens in the room and how to make the best of your consultations. Brian, please take it away.
Laughing and having fun with patients as we chat about their grandchildren and where they'll go traveling if and when a COVID vaccine happens. Next slide. Can we advance the slide, please? So it's nice to have a shiny white building, but it's more important that you understand and have an agreement with your team why we're seeing you after your chemotherapy. Next slide, next point. So we see people both for surveillance and sometimes to keep an eye out for a new cancer. Bullet point. And we try and help manage ongoing side effects of chemo, hormonal treatment such as tamoxifen, as people may be on for breast cancer, emotional support and reassurance, because people have had the foundations of their world stunned and shaken. But a lot of what we do, bullet point, is trying to future-proof your heart and your brain so that you do get the most out of all the treatment you've put up with, so that you live a long and happy life. Bullet point. Next point. Hello? Great. So what we're looking to try and help you with is weight control, exercise, which can help with fatigue and chemo brain, blood pressure, cholesterol, diabetes, to reduce the risk of stroke and heart attack going forward, which are unfortunately elevated in some cancer survivors because of the treatments we've had to use, and vaccinations to keep people out of intensive care. And I can't stress how important it is that people who've had cancer get the flu vaccine this winter. Next slide. So this is a slide from the Institute of Medicine on everything that we should be doing as physicians to help cancer survivors. And that may not be practical in a busy outpatients with 10 or 15-minute slots. So what can you do to get the most out of your outpatient appointment? Next slide. Bullet point. Because there are a lot of things that you may want to talk about that may not necessarily be top of your doctor's agenda. Next bullet point. And bullet point. So these are all things, fertility, sexuality, return to work and depression, which may need a longer chat. And it's important to flag to your team, and even if they can't handle it that time, maybe on your next appointment you'll have flagged it. This is something that does need to be discussed. Next slide. So to make the most out of your visit, I generally recommend patients to write down one or two things that they really like to discuss, they're worried won't be covered. It's really important to bring an up-to-date list of the medicines you're currently taking and the dosages, so that if you are complaining of side effects, we can safely adjust your medicines. For example, increase the dose of Lyrica or duloxetine for peripheral neuropathy. And then, it may be a way of someone stressed in a busy clinic that you say to them, look, I've one or two questions. Would you like to do them now or at the end of the visit? And in that way, you're kind of sharing control, and you'll see what works, because your doctor will have a list of things that they have to do while you're there to make sure that you're getting good medicine. But it's also important to say what you need and what you want. Next slide. So, bullet point. We don't necessarily always have a solution. Bullet point. Sometimes people ask me really good questions. I mean, yesterday in clinic, I had a patient who, the pharmacist, who suggested what her next line of therapy should be. So I have to think about that and read about that. So there won't always be an immediate answer. And then, bullet point, the GP, I think, is a really underutilized resource in some cancer patients' lives, particularly when they've finished their chemo, because GPs know a lot more than oncologists do about day-to-day management of things like blood pressure, cholesterol, and depression. That's what they train in. That's what they're good at. So it's important not to lose touch with your GP. And I always advise my patients to see their GP annually, get a fasting cholesterol and blood pressure check, maybe around the time they're due the flu vaccine. Next slide. So what you may find helpful from your oncologist is a summary of your diagnosis and treatment to date, and a plan for what the schedule is going forward. So some doctors may have a formal plan. What I generally do is copy patients on a letter to their GP. And this is a made-up example, not from a real patient, of a rectal cancer patient. Next slide. So this fictitious patient completed radiation and a low dose of oral chemotherapy for quite a nasty rectal cancer. And then she went on to have successful surgery and got some chemo to reduce the risk of the tumor coming back. And some of you watching at home today may have been taking capecitabine or Xeloda oral tablets or getting drip chemo. So she finishes that. Next slide. And what's the follow-up plan? Well, in consultation with my surgical colleagues, colon cancer survivors do get an annual CT scan. They get a colonoscopy to rule out a new colon cancer year 1 and year 3, and maybe, depending on age and fitness, every 3 to 5 years thereafter. And for colon cancer, I'll be feeling the neck and feeling the liver, because that's where rarely, but sometimes you'll feel a cancer come back. The CEA blood test can alert us if a cancer has come back, but most of the risk is in the first 2 years. So we can de-escalate from every 3 to 4 months to every 6 months at the 2-year point. And I'll be worried about peripheral nerve damage. And if it gets worse, I'll see if there's any blood test I can do for a reasonably easy fix, replacing vitamin B12, folate, or if the person has low thyroid hormone, replacing that. But next slide. And all of this is based on evidence base. This is the US evidence base, which I use to generate my follow-up protocols for patients. Next slide. And I think you can see that there's quite a lot to get through that's not going to be covered in any visit, every visit. Next slide. And this is an example of a template of a survivorship plan and treatment summary. And realistically, we're not resourced. There aren't enough of us to do this. But I think what's not unreasonable, particularly when people do move to other countries and other hospitals, is to have a treatment summary of what cancer you had, how it was treated, and what your follow-up plan is. Next slide. Bullet point. So, as I think the previous speaker eloquently pointed out, it's a partnership, and maybe we've been fortunate enough to take care of people while they were on chemo, but as they move on from chemo, more and more the patient has to take control of their own destiny. Bullet point. And it's not easy. And look, I struggle with my weight, but a change that I do for a month becomes a habit. And that's why I was doing exercise classes in the car park outside, socially distant, at 6:30 this morning. So I'm not suggesting that's going to work for everybody, but it certainly is possible when you take responsibility to change one thing and make it a virtuous habit. Next slide. So some GPs will have links to local gyms and can do exercise prescriptions, and do try and link into your GP regularly. Next slide. because all of these things are risk factors for cardiovascular health, avoiding stroke and heart attack, and reducing the risk of cancer coming back going forward. Next slide. And we try with the GP colleagues to help people stop smoking, get their cholesterol under control, and I'm fortunate enough to work with cardiologists who are interested in survivorship and reducing the risk of stroke and heart attack in cancer survivors. Next slide. But all cancer patients really benefit, some of them more at risk from others, from getting control of their blood pressure, and that's where the GP comes in. Next slide. Exercise. I think it's a bit of a cliche, but if we had a pill that did for cancer survivors what exercise does, it can help both with fitness, function, mood, vitality, and it can stave off dementia, and it may help recovery from the chemo fog, which up to 10% of patients experience mentally. So start small, listen to your body. But there are trials which suggest that people who do a little bit of exercise 2 to 3 times a week, and maybe as they get better, join an exercise class, do an online training course, see a personal trainer, whatever COVID allows, that people who very gradually push themselves, even if they're tired, they find they can do more. Next slide. So to wrap up, I hope I've given a brief explanation of why people are seen in follow-up. You may find writing down a few questions is helpful. We won't always have the answers, but we can try and get you going in the right direction towards either finding a solution or a way of living with the problem. Please bring a list of your meds and doses so that if we're changing around any medicine, we've got a full picture of what you're on and can keep you safe. And this is a partnership, but you're the most important person in it. Our job is to do our best to keep you well and happy. Next slide. And remember, there's a lot more important things happen in your home and in your community than in the shiny white building where you used to get chemo. Thank you very much.